Well, good afternoon. Welcome to DCA's Digital Transformation in Healthcare webinar. My name is Molly Irochi. I'm an Executive Vice President at DCA Asset Management. DCA is a company concentrating in asset management, fund formation, and advisory services. Today, we are delighted to have Seth Merritt, CEO and co-founder of Welby Health, Louise Hardman, Director of RealmSpark and Investor Engagement at ASU Enterprise Partners, and Dr. Michael Schnaus, hospitalist and physician leader in the Twin Cities. He's also an assistant professor at the University of Minnesota, where he holds leadership roles in research, education, and quality improvement. I am going to share my screen. A reminder before we get going that this information does not constitute investment advice, recommendations to buy or sell securities, and is not an offer or solicitation by DCA or its affiliates for the purchase or sale of securities. This webinar is for informational purposes only. And with that, before we get into our discussion for the day, I wanted to give you a brief overview of our research report, Digital Transformation in Healthcare Trends, which highlights the growth of the digital health industry, the current funding and valuation landscape, and key trends that we are focused on. For perspective, the U.S. digital health market was valued at just under $80 billion in 2022 and is projected to grow to just under $300 billion by 2030, representing a 17% CAGR. The focus on digital health was accelerated by the development of the internet, mobile devices, and wearable technologies, the need for health services to find new solutions for our aging populations, and the shift to patient-led care. While investment dollars into the industry have increased over time, the pandemic truly catalyzed activity, driving more investment in the 2021 to 2022 timeframe than the previous 7 years combined. During this time, valuations also increased in both the public and private markets, with public market valuations peaking around a 15x multiple of enterprise value over revenue multiple. The industry has since seen a sharp decline in funding and valuations, with public market multiples now in the low single-digit range. We believe the markets are reflecting fatigue, funding concerns, and elevated expenses, but feel that they are underestimating and potentially misunderstanding the scope and size of the digital transformation effort that is still needed. We estimate that we are at an inflection point and are keying in on 4 trends: generative AI in healthcare, clinical workflow automation, optimization of EHR data, and consumerization of traditional care models. We believe these segments will be prioritized because they are the most in need, receiving the most attention due to key technological advancements, the least likely to be cut out of budgets in the near term, and solving issues around data aggregation and optimization for the industry. For generative AI, we anticipate the focus will be on improving diagnostics, raising patient engagement, automating administrative work, and increasing accessibility. For workflow automation, new technology is helping to automate provider workflows, improve efficiency, leading to better patient care. EHR data optimization, we truly believe, is a key focus area for health systems and providers because there is such a large inefficiency gap that's emerged between the available patient data and that which EHR systems can access. And finally, consumerization. This is the future, we believe, of healthcare, which could be the primary area that improves patient engagement and outcomes over time. Our report will be sent out after this webinar and will be available on our website, www.dcaam.com. And with that, I'd like to quickly introduce our panelists, and then we can get right into more formal introductions and our topics and discussion. Seth Merritt, as I said earlier, is co-founder and CEO of Welby Health. He has 15 years of experience in the industry and has helped some of the largest American healthcare companies plan and deploy enterprise-wide programs. His passion for lowering the cost of quality care and improving accessibility for all patients not only led to success in his endeavors, but also catalyzed the launch of Welby Health. Louise Hardman, Director of RealmSpark and Investor Engagement at ASU Enterprise Partners, leads ASU's InvestU, which is a premier investment network that connects entrepreneurs and investors across Arizona State University's global ecosystem. The network focuses on seed to Series A startups that are post-product and pre-scale. InvestU has facilitated $4.2 million of angel investment into 16 portfolio companies since 2019. And Dr. Michael J. Schnaus, who is a hospitalist at 2 large urban hospitals with the Health Partners system in the Twin Cities area in Minnesota. He serves as core faculty and assistant professor at the University of Minnesota's Internal Medicine residency program and is a medical director of research there. And with that, I'm going to stop sharing my screen. And I think now would be a great time to have each of our panelists give a bit of a deeper insight into who they are and their backgrounds. Louise, I'd love to have you start.
Great. I'm Louise Hardman. I run InvestU at Arizona State University. As Molly mentioned, we're an investor network that connects investors to early stage deal flow between seed and Series A. We source those deals from students, alumni, faculty, staff, and investment partners. And we have 16 portfolio companies. Almost 2/3 of those are in either life sciences or health technologies.
Excellent. Thank you. Seth?
Sure. So I am Seth Merritt. I spent most of my career in, I guess you would call traditional healthcare, working for large payers, and just spent a lot of time in value-based care, starting from, even capitated models with providers. And then as that has evolved, going into more ACOs, pay for performance type programs and things like that. Since then, I discovered there was some gap that I felt more interested in pursuing, I guess healthcare from the outside in, and started the company that I work for now, Welby Health, where we focus on providing resources to patients, specifically seniors who have chronic disease and need additional support that is not traditionally available through, existing resources. So excited to be here and, provide some input into, my view on things.
Thank you, Seth. Michael?
Yep, as mentioned, Michael Schnaus. I'm a hospitalist and internal medicine physician in the Twin Cities up here, working out of both urban and semi-urban hospitals, including a level 1 trauma center, which is associated with the University of Minnesota. I've had the opportunity to be on a number of leadership teams throughout my enterprise and organization, which includes a care model delivery arm, a research and education arm, as well as a health insurance or payer side arm. My clinical and academic focus is really around quality improvement, system process improvement, and really how do we kind of utilize and leverage different innovative solutions, including technological solutions, for the betterment of our patient care and our day-to-day operations.
Excellent. Thank you. It's wonderful to have you all here. We've got an incredible group, and I'd like to get right into our questions and topics. So let's start by level setting on the industry today and where you each think the biggest pain points in healthcare are today and how technology can help solve some of these problems. Louise, would you like to start?
Sure. I'm not a physician, so I will let Michael address from the clinician's perspective. But from an investment perspective, we are seeing an increase in deal flow in the areas of digital diagnostics and workflow automation, particularly back-end processes. And then anecdotally, I think it's really interesting. In the last quarter, I've heard a number of pitches where founders are positioning their value proposition with respect to a physician's time and using phrases like, we want to give joy back to physicians. We want physicians spending more time with patients and less time on paperwork. So those are anecdotes, but I think it's quite telling and reveals that the healthcare sector now is really ripe to bring in more automation and more efficiency improvements. And technology can certainly enable that.
Agreed. Michael, any additional context there?
Yeah, no, I appreciate that, Louise, and I think that is kind of right on the money. So, the healthcare industry, I guess, specifically down to the healthcare kind of provider level, underwent pretty massive changes over the last 3 years. I think the catalyst for that was COVID-19. There was obviously momentum to change prior to COVID-19, but this was definitely a spark for us to recognize, we needed to make some changes, and we need to make some changes in the future. So challenges that we're facing right now, to echo what Louise said, it's provider burnout, leaving the workforce, whether that's the physicians, our APC colleagues, nurses, finding ways to have adequate staffing to kind of meet the needs of our patients. And then really kind of looking towards how do we embrace change, which is difficult in healthcare, for both the structure of our healthcare system and for our team in an environment that frankly has been, facing a lot of headwinds, both now and I think into the future, which include an aging population, fairly rapidly increasing medical knowledge and trying to implement that at the ground level, increase, consumerization from our patients, and they're expecting their individual care, amongst, others. So I think, as we look towards what our staffing models look like as physicians, certainly it's how do we try to make them more efficient, and how do we, again, bring that joy back? That's the phrase that we're trying to use a lot and ask the question of, is in the setting of this tough environment, which includes some financial challenges too, how do we bring that joy back to the career? How do we optimize what physicians are doing, which obviously sometimes is not on the administrative side, but rather on the patient care side and the thinking and brainstorming and having conversations and educating our patients.
Excellent. Seth, any additional commentary?
I had just jotted down some notes and I said the exact same thing. I mean, my biggest thing was just staff burnout, which you guys have already talked about. But I mean, it's just such a big push where there's so much more being asked of clinicians up and down the chain that it is causing a lot more burnout for them. I mean, a couple of things, just the move to value-based care, there's a lot of changes of how things need to happen, what kind of data they need to report. And that's just problematic on top of an already complicated profession. And then I think the pivot we see a lot, from COVID, along with, all the other changes happening, is like everybody else who's in a knowledge-based economy gets to go home and work a much more flexible schedule, where traditionally healthcare providers don't get to do that. And I think that's just aggravating an already complicated situation where these, physicians and nurses and staff do just want to, do more remote work, and traditional healthcare providers are not used to that market. So on top of all the other complications, like how do they pivot into that workforce? And it's just, difficult. And it's so entrenched, you can't really break anything that's already there to move into a new model. So how do you bring on these new components without disrupting what's already there that is working and required to be maintained, dealing with patient health?
All excellent points. So as we've just talked about technology opportunities to solve problems, the next key consideration is, what are the constraints to actually adopting this innovative technology in today's market? And I'll throw that out to you all, Michael, if you want to start.
Yeah. And I think, Seth touches on one of those right off the bat, which is that, when you think about what it looks like at the ground level for physicians or clinicians, right? It is kind of the same thing over and over again. We all become creatures of habit. We get fairly entrenched, I think was the word that was used, in our day-to-day existence. And sometimes we kind of lose sight of where those inefficiencies may be. So there's some of those challenges in terms of bringing that in. It could be a cultural challenge related to, experiences varying from 1 year right out of residency, training with new technology, versus 30 years doing the same thing. How do you kind of bridge those experience gaps and, I guess, kind of habit gaps, if you will, to try to change some of that culture? I think there's always, other challenges. There's questions related to, what's for any new technology, what's the interoperability? How do we how do we utilize technology in a way that can be used in my healthcare system, but also in, other systems that may be around the country that patients are going to. And I think really just kind of, I guess the other kind of headwind that we're seeing here is around the finances of healthcare as well. And just how do we kind of look to the solutions as opportunities for us to reduce costs, improve patient care, if they're maybe not generating revenue right off the bat when it's a fiscally challenging year.
Seth, anything from your perspective prior to starting Welby and now with Welby, what kind of challenges are you running into in the industry to adopting new technologies?
I think one of the biggest challenges is just fear. There's a lot of new innovations out in the market, and to make a decision of we're going to deploy this with real patients, with real physicians, is a concern. If you're going to deploy some new technology and it breaks and people die or things like get worse than it was before, that's a huge risk. And I think as new technology comes out, the whole point is to be disruptive, and the definition of disruptive is this hasn't really been done a lot before. So to do that with actual patients is very difficult. So how do you kind of work within the existing infrastructure while providing innovation is important. And then I think something just unique about healthcare is there's a lot of incredibly vested interests in the current model. And to ask any of those people to really significantly change, whether it's the insurance companies, the pharma companies, the hospitals, the physicians, they all have financial incentives to maintain the current structure and to come and disrupt that on some level, to say, we're not going to use traditional insurance, or we're going to reduce hospitalizations and length of stay, or we're going to reduce physician compensation because there's going to be less visits and reduce the workload, or those kinds of things. That all hits somebody, and all of those entities are very powerful to say, we don't want to move down this road. So I think there's some combination of appropriate fear of not doing things that are inappropriate with real life patient care, and at the same time people who are pushing back for either legitimate or potentially illegitimate reasons if it's not something that benefits them specifically. And I think that is just a challenge, especially part of why we exist is coming in from the outside. This is not going to happen within existing infrastructure. But then at the same time, you're some third party coming in and trying to be deployed at a doctor's office or at a hospital, or work with a healthcare provider. And just, again, if you're being disruptive and innovative, if you're small, coming into a large organization and trying to make an impact there is always difficult. And if you are something significant of size, then you're most likely not going to be super innovative. So it is incremental, but I think there's just a lot of headwinds to get those things pushed, and it will change. There's, Dr. Schnaus said, there's a lot of pressure financially on a lot of providers and all parties to make it work more efficiently. And I think as that pressure builds, they're going to be required to do some of these more innovative solutions.
Agreed. Louise, anything else to add?
Yeah, I think the comment about those entrenched incumbents is the biggest challenge for startup companies, both from a competitive landscape, but also the complex procurement process and the infrastructure in place that startups have to navigate. One thing we really dig into is a startup's go-to-market strategy. And it's one thing to get buy-in from the end user, and maybe that's the physician, but if that physician is not in a position of power or influence over the procurement process, then it's going to be a challenge to get integrated. And what we've seen be successful for some companies is either working through distribution networks where they're bundling new technologies with existing software contracts, or starting with smaller physician-owned practices where the end user has more influence, and then hoping to scale from there into the larger hospital systems.
Excellent. Thank you all. Great insights. I want to move into artificial intelligence, which I know is very fuzzy, but it is important. It's also not new to healthcare. How are you each viewing AI in the industry, and what is your take on how it should be incorporated into healthcare solutions in order to be the most beneficial to patients, health systems, and overall outcomes? And I'll let any of you start.
I can start there if you don't mind. At RealmSpark, we have been looking at AI for a long time from the education perspective. And our thesis there really revolves around leveraging generative AI to enhance learning and not necessarily replace or substitute human intelligence. And I think that same thesis can be applied to healthcare. I don't expect AI to take over a doctor's job anytime soon. What we do expect in terms of adoption is AI that's assisting a physician, helping them work at greater speed with fewer mistakes. I think digital diagnostics is a great opportunity there. Medical imaging has implemented AI already in the last decade in a number of areas. And of course, non-clinical workflows. We see a lot of traction from investors into generative AI for back-end processes, scheduling, administrative.
Seth or Michael? Yep.
Yeah, I would agree with both of those things. I think AI has a lot of opportunity in healthcare. It's also got some risks, like you can't go too far with what it can do and can't do. And I think that's just important to really consider. You know, there's great opportunities of things that it can do, but you don't want to go too far with it. I would agree with Louise that the biggest things I see is more in workflow automation with some of the AI solutions today, just because there's a lot of manual work that is not super repetitive in healthcare, but it's repetitive enough that it can easily be replaced out with AI. That's going to immediately reduce a lot of costs. And I think like a couple things we're using it for is inpatient engagement pieces, because there's a lot of stuff you can put to patients just to remind them to do certain things, take better care of their health, you know, get their schedules completed, things like that, where it is improving efficiency that doesn't have to be done by a physical person, but it's not necessarily clinical care, but it is patient facing pieces. So I think in the nearest term, there's a lot of opportunity and low hanging fruit more on workflow automation pieces and sort of borderline clinical work in terms of patient engagement, and also helping to triage things for physicians. I think that's also going to help a lot of the AI models do better, because physicians are trying to improve their workflows as well. So if they can start training some of those models of what they should and shouldn't be doing, you know, maybe 5 to 10 years out, you'll start seeing more of that. And I agree, the digital diagnostics is very interesting. I don't know how soon that's ever going to be like fully deployed or adopted or embraced, but it's definitely very interesting, like some of the research they've seen in that space of what it can do.
Mm-hmm.
Yeah, I think I definitely agree with all those statements. I think when I kind of think about it from a physician's standpoint, what AI can offer, and maybe where we need to put up the guardrails, at least initially on, and this is going to be an evolving, obviously a very evolving field within healthcare itself, but it's that the opportunity exists for AI to really kind of be a partner with the physicians, at least initially, to enhance our workflow, hopefully enhance our efficiency. And really, I think the other one that from a quality improvement and patient safety standpoint that I see, and again, where the digital diagnostics goes, where it actually is being used right now, just for Louise and Seth's, you're probably aware of this, but for our acute stroke patients, there is actually an AI model that's doing digital assessment to see if there's, as it is such a time sensitive issue for our patients that come in through the emergency room, it's a way to more rapidly identify patients that are going to need immediate intervention when we do have a time window that we can operate in. And I think what that's showing is really that it's going to hopefully do two things. One, by improving our efficiencies and allowing us to act sooner, we might just be able to intervene in a quicker stance when patients come in that have, a lot of those kind of critical illnesses that we call them sepsis, stroke, heart attacks, those types of things. And I think that ability to alert you to it is critical, especially when you're seeing a ton of patients, you're in a busy ER setting, you're overwhelmed with volumes. It's really kind of where can AI close those blind spots that we may have, especially during such a clinical practice. And then I think the other piece of it is, can it be that kind of partner for you along your way? Can it help you write your notes? Can it help you organize thoughts? And then the other piece is, as we have more patients that are seeing multiple specialists, living longer, increasing complexities, and you look at the field of like hematology oncology, to get through one hemonc note from the Mayo Clinic takes me about 10 minutes now, because there are just volumes of information that I have to get through, and I'm probably just skimming the surface at times. So can something like AI in that like generative mode that we see through things like ChatGPT, can that synthesize information for me and present it in a way that I can fully understand it? And I think where I'm kind of really see its impact here is in that quote unquote, gray area of medicine where you're still trying to figure out what exactly is going on. What's the problem? What's the diagnosis? What do I need to do right now? And how do I triage, to what you said, Seth? That's hard to do. And that takes a ton of time in the current state. And that's where I think that, at least for the, what I'm excited about is that piece. And then, the guardrail piece is, yes, we need to make sure that this is safe, right? If there's implementation of artificial intelligence to do a specific task and we start relying on that, and there is a breakdown or an error or a flaw in it, that can lead to adverse patient events. And obviously, I think that's where the fear component is. And that's why it's going to take time to implement.
All great points and perspectives, and certainly more to come on this topic for sure. Seth, I'd like to come to you now just to get your perspective on the rise and the need for digital health solutions. You've been in the healthcare world for over 15 years now. How have you seen things change and evolve? And did the pandemic create an even greater shift or inflection point over the last couple of years?
Obviously, the pandemic changed a lot of things. I think it just changed, more than anything, it changed the Overton window of what is doable in healthcare, both for patients and physicians, where before, like, the thought process was, I have to go physically into the doctor's office to get care delivered, and everything's going to be done in 15-minute increments so I can bill an office visit code. And that has just changed, where at a very high level, like, I can do this via video. At a more granular level, can I actually do this with an app and like do some work with a patient between a provider where I don't have to physically do that? So I think it just changed perspectives for a lot of people, and that's where we're now trying to get caught up. Like we talked about, the consumer expectations. If you're a consumer and your expectation is I'm going to handle all my healthcare on an app like I do with my bank, and you're going into a healthcare system that hasn't deployed new technology in 15 years, there's just an enormous gap, and you can't just turn that on. So like, there's a risk all those patients just leave and go somewhere else. At the same time, like, again, financial concerns, entrenched visits, entrenched perspectives on things like that's not going to happen. So that's where I feel like we are trying to get caught up there and connecting, what is realistically doable within this infrastructure versus like what physicians and patients actually want out of the healthcare system going forward. Because right now there's just a huge gap with that. And I would say more generally, my historic experience in working is, despite all the numbers of this being whatever it is now, a $6 trillion, $5 trillion industry of healthcare, it's very antiquated. There's a lot of paperwork. There's a lot of processes that probably haven't been updated in the last 35 years. And that is, again, because there's just a lot of entrenched interest in the systems. So to come in and say, like, I'm going to convert a VHS tape to a downloadable, solution that I can get on my phone in 3 seconds, is kind of the position that we're in. There's a lot of backfill stuff that needs to get, up to just normal speed, let alone be innovative in how things are going to be done in the next 15 or 20 years. But there's just a huge push now. And I think the biggest piece that will move us there is, again, either the financial constraints that push everybody, like, I can't do this anymore with people or at this cost because I can't compete, or consumers are just going to change and say, I'm not going to go to a provider unless they have all these solutions. Like Amazon just announced this deal with, One Medical, and like, it's now part of the Prime Care. Like, obviously, if I'm a Medicare patient and I've been with my physician for 35 years, I'm not going to just move over to Prime and go to, One Medical. But if I'm 20 years old and I'm buying, Prime anyway, of course, that's a perfect solution for me. And like, those things will just transition. If you're not in that kind of model, like, those consumers will go away. And that's going to provide like further pressure on people to move and be able to compete in that space. And I think that's what will happen. It's going to be slow unless something just dramatically changes, but there's going to be a continued move on all these fronts that we talk about to like make that transition is my view on it.
Michael, over to you. Given your unique perspective as a hospitalist and clinician, how has digital health transformed in recent years, more specifically since the pandemic?
Yeah, no, it really is I think one of the critical questions that we're trying to answer right now. So as Seth spoke to, I think the first wave that we saw was moving away from that, what we call brick and mortar clinic visits and physician visits, to how do we really take this into like a telehealth realm, or how do we do some of this clinical care more virtually? And that was driven by really kind of that critical pressure on space in the hospitals and clinics that we were seeing, as well as kind of the the acute illness of the patients with COVID, not wanting to expose them or others or our clinician teams, which we're already under a lot of stress, to potentially disease that or infection that was going to set them out 10 days, right? So it's to Seth's point, it's going to be, where are the pressure points strong enough where there needs to be make a change? So it's telehealth, it's the ever, I guess, existing question of who owns the data. It's kind of a mix right now between different healthcare systems, EMRs, and the patients. And moving into more of a space as in current state, at least, to say, how do we empower patients to have their own healthcare data, to have their imaging test results at their fingertips, utilizing apps, again, to say, you need to remember to get a colonoscopy, you need to remember to visit this or this doctor, and using those kind of triggers to consumerize healthcare a little bit more, and really kind of shift the pendulum. The goal is to shift the pendulum away from something like acute care, hospital, very sick, to how do we do this more outpatient? How do we focus more on prevention, which I think is a critical piece to this as well. And so those are the questions we're asking. It's right now, it's kind of the deployment of telehealth, I think, in current state in 2023, that's been driven by the pandemic, and how do we kind of maximize those? Again, there's a physician clinician workflow piece to that, as well as a patient comfort piece to that. And then I think it's going to be, how do we put and empower our patients and our teams to make it more patient-centered care using technology into the future. And those are what's on all the whiteboards that I'm seeing, at least.
Louise, from your perspective, since you've joined InvestU, how has the deal flow side in digital health, or even more broadly in health tech, changed? And are there more specific trends or themes that you're really starting to see come to the forefront?
Yeah, I think as your graph showed in the slides at the beginning, there was just a huge bubble for capital dollars during the pandemic. There was so much available funding for startups that really anything related to mental health, telehealth, care delivery got funded. And we're seeing a much higher barrier now for those capital dollars. So from an investor's perspective, I'm seeing hyper focus into the go-to-market strategy and the target consumer group. A general mental health platform is no longer being funded, but a demographic based platform that's hyper targeted towards the elderly or hyper targeted towards women, those are coming forward as solutions now that are standing out in the crowd. And then looking ahead, the weight loss market, I think, is especially digital health friendly. It will be especially friendly for telehealth visits, for at-home monitoring, and transfer of data back to the provider. And so I'm really excited to start seeing more solutions to address this huge growing market driven by Ozempic and the weight loss sector.
Excellent. There certainly has been a lot of discussion on that particular topic. It'll be interesting to follow it going forward. Seth, can you speak a bit to how the industry's need for clinical workflow automation came about, and how technology broadly is helping to streamline traditionally manual processes? I know we've talked about it a little bit. Would love to get go through that question in greater detail.
Yeah, I think, like Dr. Schnaus said, replacing a clinician is very difficult. Replacing an administrative person who's pushing through paper claims to get them paid is a lot easier. So I think there's way more people pushing through paper claims than physicians out there. So there's a lot of things that still require a lot of manual work. And again, there's not a lot of interest from incumbent players to necessarily fix those things. Like, insurance companies sort of like that it's a pain in the butt to submit claims, because it's harder for you to submit claims. It's easier for them to not pay them out. And same with the hospitals in some sense. It's like, well, I got this huge overhead of staff, and that's why I need a big rate increase from my insurance company so I can pay for all this, big bloated staff. So as that stuff pushes away, that's where incumbents can come in and say, we can do this in a more efficient way. I've built this solution completely around either pre-authorization automation or billing automation or collections improvements or improving like the patient component of collections. Those types of things are where it's much easier to come in and say we can fix this versus using AI or some other solution to replace a clinician. So I think that is why you're seeing a lot more disruptive innovation in the operational workflows than you are in more of the clinical workflows. And we see it all the time. I mean, we weren't even doing a lot of operational workflows, but as we started working with more and more clients, we see these huge gaps of things. So it's like, that's actually relatively easy to automate. And if we're already working on that, like, why don't we just fix that for you while we're doing this? So I think there's also a lot more low-hanging fruit in workflow automation that may not be super differentiated in terms of investment or products or things today, but there's just like a lot of improvements that can be had on things that are a little bit more tedious and manual in the system today.
Excellent, thank you. Michael, I want to come back to you. Let's dive in a little bit into the EHR market and data optimization. So with the growing importance of EHR data optimization, how do you see this impacting your ability to access and use patient information effectively? And what challenges still need to be addressed in this area?
No, that's a good question. And I think I've spoken to it a little bit here, but just to kind of reemphasize, there's going to be an increasing amount of data and information that we're going to be able to collect on patients. I think Louise's example of the weight loss is awesome. That's like a perfect single focused outpatient specialty type problem that can just generate a lot of data and can be presented in a way that allows clinicians to make decisions regarding, whether it's medication or counseling or education or whatever it may be to kind of get patients to the goal that they need. And as we kind of see that, increase across the different specialties. And that's one of the challenges as well with healthcare is you have just a very diverse set of conditions and complexities with a kind of a non-standard product, which is of course the human being with all the different variations. What does that look like in the future? So we're going to have individualized, maybe individualized education and treatment plans. We kind of do that already, but they're going to become more individualized. When are we going to start bringing genetics into this equation? So I think, when we start talking about the amount of data that could be facing us on a daily basis to make decisions, whether it's what's the most effective medication to use for this condition, and there might just be very simple nuances to that. What's the right education the patient needs, does this patient, need urgent, less urgent, or spread out type of procedures, surgeries, whatever it may be. It's going to be how do we kind of optimize that presentation of data into the hands of the treating teams to make sure that they're able to be efficient and make the right decisions for patients. And so that's going to be the question is how do we synthesize that data and how do we kind of how do we and optimize that data, I guess, to make informed decisions for our patients in the setting of just a vast amount of information that's going to be coming at us. And some of that could be predictive as well. So, and that would be, I think, one of Seth's points. And one thing I'd add to it is just when we look at, workflows in the hospital, but also when we look at our patient cares, can we predict out? Can we say it looks like 2 weeks from now, we're probably going to have a surge and you have an increased need for staffing, for instance, in our hospitals, or maybe we won't. And, where are we going to be able to identify that in the future? And can we do the same thing with patients and their care to kind of help again in that preventative side of things? The biggest challenge to this optimization of the EHR is probably just, again, it's talking a little bit about the entrenchment of healthcare. And I think that's some of that is, again, back to the who owns the data, right? So is there going to be interoperability? Am I going to be able to use information from patients' care that they received in a different state to help me answer my questions? how much access to this type of information is our patients going to have? And I think that's actually kind of an interesting question that I look at as a clinician as well. Is we look at an electronic health record. I know how to utilize it for a physician standpoint. Are my patients going to be presented with the same data? So if we optimize the data, treatment plans, and we have a kind of a workflow or a suggested treatment plan for a patient, they'll see that too. How do we incorporate that into our day-to-day clinical life? And that's, that can be challenging. Patients, and we talk about, the administrative questions, but, patients may, for instance, get a report on their own healthcare. Are they going to want to talk about that with their physician right now? Is there going to be an increase in the amount of communication that we're seeing, amount of inboxes, the amount of, well, why didn't you do this? Why did you do this? Are you doing the right thing for me? And so there's going to be a huge piece here that we're going to need to manage. And it kind of fundamentally, at least when you look at the kind of the care we provide to patients, it starts with the EHR. So I don't have a solution here today, but I think there's a lot of very interesting questions coming.
Yeah, I would just say, like, one thing I've found that's quite interesting on that note is, like, we get a lot of data. We do a lot of work with patient wearables and what's going on kind of outside of the current EHR. And probably the biggest thing that we hear from physicians are like, I don't want all that data. Just tell me what to do. Like, I'm already data overloaded, but what are the insights and action items out of that data? So I think that's also where more of the improvements are going to come. Like, okay, we have all this data now. What's going to sit on top of it that's going to make it actionable and usable versus here's like 7,000 reams of data that you can go review on your patients and make the perfect decision. But, we can't do that. So I think that'll be interesting. Like, where do we get insights from that data and make it actionable to clinicians and maybe not even doctors, like up and down the chain? Like, how does this work for MAs or PAs or NPs, nurses, to be able to actually better utilize the workforce today? Is just an interesting thing I'm watching.
This is a good segue actually into the next topic in question, which is around consumer-centric healthcare. So from each of your unique perspectives, and you've all touched on it throughout the discussion, particularly over the last topic, but how is the consumerization of healthcare impacting your view of the industry and the search for development of or implementation of the most effective solutions? You each have such unique perspectives. We'd love to hear from each of you on this.
I can start. I mean, it's been discussed just in the last two comments about just the sheer amount of data. But there's a couple of challenges with data, right? Bad data in equals bad data out. And so how are we controlling this consumer-centric or consumer-generated data? And one trend that we are starting to see at the university level is software as a medical device. And how are we actually turning consumer data into medical data that's integrated with the EMR and able to drive action or insights? And one of our portfolio companies, for example, I'll use his line, but he says there's 260 million smartphones in the world. Can we turn those into patient-centric medical devices through software? And that requires going through an FDA approval process, much like a traditional medical device. So that's step one, is make sure the data in is good. And then step two is integrating that with the existing infrastructure and the EHR system, and to Seth's point, these add-on programs that really make it actionable.
Excellent points. Yep. Seth or Michael?
I just see the consumer component being maybe like a little bit slower. Maybe I'm wrong in that sense, but I feel like most of the population who's really using the healthcare system significantly today is just tied into their physician because they've been tied in with their physician for a long time. As that evolves more, the expectation of consumers for healthcare is going to be a lot different. So as more and more patients enter the system who aren't already entrenched with a provider or a system, like, that's going to be important, and that's going to move to more consumerism. I feel like today, a lot of people in the healthcare space are willing to put up with suboptimal technology or solutions because I just really love my doctor. And that's gonna, I think, change. I mean, it's already changing, but I don't know how quickly it will move. That may be quicker than I think, but I think that's just super important of when consumers are actually willing to make decisions about which doctor they see based on what solutions they have available for them. So whether that is, do you have this technology? Are you available? Or is it easy to pay my bills? Or what are you willing to work weekends or in the evening? Do I have access to you? Do you have an AI chatbot assistant on your website that can answer my questions? Like, those are things that people will be looking for in the future, where today, like, there's a portion of them that are that I don't think it's big enough to make a truly dramatic change, but it's definitely evolving that way. And once that, again, pressure point becomes enough, like, we'll see more and more people like resolving that.
Yeah, I think that echoes everything that I have on this topic. I think, the consumerization piece is almost certainly going to have to be, again, centered around, and I go back to it, and sorry for being repetitive here, but who kind of does the consumer own their data, and do they have access to it, and how do they interface with that electronic medical record? So to Louise's point, just, I really like the way to think about that is your smartphone going to be a medical device in the future? And probably at some point. And then, back to Seth's point too, it's the biggest utilizers of healthcare. If we kind of look at it trend wise, it's always, it's the aging population, it's the patients within their, unfortunately, the last, 6 months of their life. Those are the patients that have the highest use of healthcare and expenditures, at least at the clinical level. So, as if we're kind of looking at it from a demographic standpoint, I know Louise brought that up earlier. What does that look like? How do we make specific patients in specific patient populations, however you want to break that down, whether that's geographically, from a DEI lens, from a diagnosis lens? How do we, empower that piece of it is kind of one way to look at it, versus just making it an individual. And then, I do echo what Seth says. I think that, this is going to be maybe even a generational thing too, over time, where the newer generations, the millennials, Gen Z and all that, are going to kind of grow up getting used to this part of medical care, and I think then integrate into that when they do have higher healthcare utilization later in life, versus right now. Obviously, you think about the baby boomer population, the aging population, it probably is a little bit less of a, less of a commonplace in day-to-day existence for this type of thing.
If I could just add
Yeah,
one thing there.
Go ahead.
Oh, go for it. Louise, go ahead.
I could add on that with respect to kind of the next generation being comfortable with technology, there also is an expectation of personalization. And one thing about the shift in data is a lot of people think of the aggregation of data allowing for, cross-sectional data analysis. But what's also happening is every individual is now creating their own longitudinal data set over their lifetime. And just like a clinical trial, that's really valuable data to follow one person throughout chapters of life. And so I think there will be a shift towards an expectation of hyper-personalized care as Gen Z and millennials age into those brackets where they're higher healthcare users.
Great point. Seth, go ahead.
I was just going to say something that's sort of interesting in the consumerization space. It's sort of niche right now, but where there's sort of like a sandbox in a sense. It's like some of the DPC models, the direct provider models, where they can just go to consumers and say, like, it's all cash pay. Like, we'll handle you from a primary care perspective, but we're going to spend the money on the apps and the solutions, and you're going to get better services and things like that. And then you don't have to fit within the insurance company's work or like a large health system. So I'm interested in, maybe seeing the DPC space in terms of innovation and how some of those things, those actually pan out, because they're specifically targeting the younger demographic who isn't using a ton of medical services. They don't need to fit within the existing payment structure. They're sort of small where they can experiment on things. So there's some large like aggregators and things around DPC, the direct primary care model, that are just interesting. And if I was looking for innovation and consumerism, that's probably where I would look. And that stuff, once they sort of figure it out, is going to migrate into the larger systems going forward. So just interesting to watch that space. But I never really paid attention to my prior life working for insurance companies. I was like, oh, you guys are cash pay, like, it has nothing to do with us. But hearing from the provider side and like some of the reasons that they do those things is quite interesting, especially on the consumerism side.
Agreed. An early and evolving space for sure. Are there any questions from the audience? I'll give you just a minute to add anything in, if so. If not, I think we can wrap right here. Thank you all for your participation. We really appreciate your time, your amazing insights, and we look forward to hearing from you again on this topic and getting a chance to see how things have changed and shifted over time. Thank you guys so much.